lipo 360, and then we'll continue on to the tummy tuck and axillary plasty. It looks like it's on.
Yeah, as far as the brightness goes.
Hi there, good afternoon, welcome in. Hi there, welcome. We're working on the breast augmentation lift right now. Having a fantastic Tuesday so far. We are just working on this procedure. Just a breast aug lift. And then this patient's also doing tummy tuck and axillary plasty. Working on the breast augmentation. We already put the implants in, so we're working on the lift. have scrubs on, and then hairnet, gloves, and a mask. If I was near or on the sterile field, yes, I would need a gown. But yeah, we're just working on the breast dog lift right now, and then we'll continue on with the tummy tuck and auxiliary plasty. Thanks for hanging with us during this procedure. We appreciate y'all. Hope you're all having a fantastic day so far. Happy Tuesday. Dr. Phillips here this morning. He is a board certified plastic surgeon. We are located in San Antonio, Texas. That being said, too, we have tons of patients from out of town, out of state. So, lucky enough, we're able to accommodate y'all with that. Hi there, Tiffany. Welcome. So, during surgery, see, we don't really have any issues with that, but it's basically a blood clot. So, it could be multiple causes. We usually see, if we see any type of DVT activity, it's after surgery because patients aren't getting up and walking around enough. So there's no blood circulation, they're not wearing the leg compressors, anything like that. The medications that you were on before surgery, like if you have any blood pressure issues too, that can probably contribute to it as well as diabetes too. So, but yeah, most of the time if we see any DVT activities like a couple days after surgery, you'll see it. But that's also because people aren't, following post-op instructions all the way. Getting up and walking around every however many hours, wearing the leg compressors, help with circulation, things like that. Hi there, Melissa. Welcome. Nice to see you again. Hope you're doing fantastic. We are just working on this breast dog lift, and then they're also doing an auxiliary plasty too, which goes towards the armpit. And then a tummy tuck as well. So this patient is doing a couple different procedures in the surgery today. So definitely a little bit bigger one. Thanks for the love, Melissa. We appreciate that. Thank you. Hope you are having a fantastic Tuesday so far. This is our last case of the day. We did have one earlier, a smaller case. That patient did not consent to social media, so we did not get on lives or anything for it. Yes, good condition for this patient. this is a bigger case. So this patient did lipo 360, so we did have to flip the patient. They also added on a breast lift, which takes time, and then the axillary plasty also takes time. So some of these add-ons and things that needed to be done, add on time to the surgery. But yeah, our case earlier, our first case was lipo 360, and that was about an hour maybe. So this one's definitely longer. So for recovery for this, it's anything we kind of include with a breast jog and a tummy tuck. We kind of call that a mommy makeover. This patient also did axilloplasty, so a little bit more than a mommy makeover. So we usually say 6 to 8 weeks for basically to where you're kind of feeling back to normal. Of course, throughout those 6 to 8 weeks, you're you know, past, you're past to do stuff by the NP, whether that be things, lifting stuff, things like that. So, it also depends on too, what you do at your job. If your job is, you're always moving, lifting, it's pretty physical, or if you just have a desk job, that also depends, on back to work stuff, but.
You just sit underneath the table. Oh, down in the blood. Oh, thank you.
100, Chen.
brachioplasty. So Crohn's disease. So before we do this with all our patients, especially if you have any type of medical history, things like that. We always do your labs. If you're doing something with, breast augmentation, we make you get a mammogram. Um, and then also, if you need any type of clearance, we have you cleared by, your primary or specialist doctor. If you have specific things, so we always make sure that you're cleared if a clearance is needed, um, or if not, as long as you're taking your meds and keeping different things under control, then yeah, you're good. Um, but yeah, either way, we still will make you get, your blood drawn. We'll have you go get your labs and a mammogram. Of course. Thank you for your questions. We appreciate that. We're just working on this press dog lift. Um, Also doing axilloplasty, which is into like this side area, into it's like right below like where your we hope like your bra line, but like so around that area towards your armpit. And then we already did lipo 362. So this patient's doing a few different procedures. But yeah, if you're interested, if you have any questions, you can always fill out that contact us form I pinned in the chat. You can also click the form that's pinned at the top of our TikTok page, the Get a Quote form. Both of those forms are basically the same. They go straight to us, straight to our team, and then you're directed to this, right person in our office. So that way they can answer your questions, get the ball rolling, get you pricing. If you're interested in financing, they kind of talk to you about that process or payment plans. They can help you get scheduled for a procedure. Like if you're interested in doing a virtual consult, they can get you scheduled for that. So, and also if you come through social media, you get a percentage off your quote, so make sure to mention that too, if you fill out one of those forms. Hi Kimberly, most of the time we are doing under the muscle, but the surgeon does, the surgeon will talk to you too about different preferences that you have and take them under consideration, talk to you about, his professional experience and things he's seen. So yeah, this patient's doing implants and a lift. Of course, thanks for your questions. Yeah, if y'all have any questions, if y'all are interested in, talking to, some people in office about quotes or pricing or financing, just talking about the process a little bit, definitely fill out that form. We're just finishing this breast lift. We already put the implants in with the tummy tuck, so we're gonna be signing off here in a minute, and then we'll probably come back for part of the tummy tuck. So definitely fill out that form, follow us. Thanks for liking and sharing. We appreciate you, Melissa, for all the love. And check out our Instagram and our TikTok. We post on both, Dr. Bam. So yeah, again, here with Dr. Phillips this afternoon. And he is a board certified plastic surgeon here in San Antonio, Texas. So follow our pages, fill out that form, just get the ball rolling, get some info and get some questions answered for you guys. And don't forget to mention you're from social media, so you'll get that percentage off your quotes too. So we appreciate you guys. We'll be back on in a little bit for the tummy tuck. So